Hi, this is Dr. Jayalakshmi, Mithran Dental, Adyar, Chennai. Today I am here to discuss about few of the myths that I come across with scaling. Scaling is basically professional cleaning of your teeth. What happens is many patients feel that once when a scaling is done, the tooth starts to become weak or shaky. Now if you look at years of deposition of this tartar around the tooth, generally tends to push the gums and the bone away from the teeth. So for a tooth, a holding structure will be the gum and the bone underneath. Whereas in this scenario, the tartar becomes the holding structure for this tooth. And these tartars are basically the microbial deposits, that is all the microorganisms, that is all the germs that is accumulated around the tooth. This will naturally release toxins over time and keep attracting more and more bacteria to it and keep increasing this tartar accumulation. So this definitely has to be scaled and removed. So the teeth has already become weak from this tartar deposition. So once when we scale the tooth, that is remove all these tartars away, the tooth starts to feel a little mobile. But this mobility will gradually reduce over time and the tooth will actually start to feel much firmer than before. If in case there is much more mobility that which is observed than normal, then in such a case a small splinting of the tooth could be done so that it makes the tooth firmer there. And few other thing is that if in case I get a scaling done, the tooth, there is a spacing that increases between the teeth. People start to feel that there is a gap that is being created between the teeth. Actually, if you look at these gaps are not being created by the scaler, because the scaler does not have the efficiency to push the tooth away and create a gap, but these gaps are being created by the tartar which is deposited around the tooth over time. These tartar generally makes the tooth weak and pushes the tooth away, wherein like when we scale and remove the tartars away, the spacing starts to appear between the teeth. And one another thing is that some people feel that the teeth become sensitive after scaling is being done. It's because once the tartars are being removed away, the tooth is being exposed to the oral environment. So whenever when we take hot or cold liquid, since that the tooth is all of a sudden being exposed to the oral environment, it starts to feel a little sensitive. But this sensitivity is very temporary, transient, and it will settle over time. Even in a week's time, you might not have this sensitivity, or some people might not have this sensitivity from the beginning itself, from the time they have scaled itself. So scaling is a minimal maintenance that which one can do to take care of their oral health, and getting yourself scaled for every 6 months to 1 year definitely is a good thing, because once when you are getting a scaling done, you also happen to get a oral checkup done. So if in case you are starting with any other dental issue, that could be identified from the beginning and it can be treated at the earliest. So treasure your smile, because it's one of the priceless possessions that which you can have. Thank you.